Welcome to week 14, and this week we're going to be looking at public health. Make sure you read your transcripts for this week and also review the PowerPoints on an individual basis. I put public health in the back of this course rather than putting it with hospital systems and outpatient systems because it's really a very important but separate entity in the delivery of our healthcare systems. So this first part, we're going to look briefly on the history of public health and the purpose that it serves. And here are the objectives, which you can read over. But public health refers to the agencies that look at treating and maintaining the health of populations, whereas everything else we talked about before is related to the individual. So this includes federal policy and state policy on education, research, monitoring, etc. So this is the population as a whole. So determinant of the public health interests, the condition that they're reviewing must be severe enough that its effects warrant some type of intervention and monitoring. It hopefully is preventable, or at least to be mitigated or reduce the damage of that through interventions. And it's got to be prevalent enough in the population to warrant some type of intervention and monitoring. So a prime example of that would be flu shots. Flu season is severe enough to warrant monitoring. It can be preventable with the use of flu vaccines, or at least maybe not preventable, but the severity lessened. And it's got to be prevalent enough to warrant it. So flu season can spread very quickly, and you'll often see reports on how many states have had high outbreaks of flu. History of public health, it actually started in 1798, and its original purpose was to protect merchant seamen through a network of hospitals and systems. Then in the 1800s, we had the emergence of public health, and one of the first ones was the smallpox vaccination was first introduced into the U.S. Smallpox was a highly contagious disease known to wipe out entire populations of people who were exposed. So the smallpox vaccine was vital. Today, smallpox has been eradicated across the world. They also had the National Quarantine Act going from state to federal level. They had immigration legislation passed assigning medical exam of immigrants to the United States. And then in 1893, they had the first U.S. School of Public Health and Medicine, and that was what is now known as the Walter Reed Medical Center. The 1900s to 1944, just look at this. Pneumonia and influenza in 1900 was the leading cause of death in the U.S. Why? They couldn't treat it. Okay. In 1902, the Marine Hospital Service changed to public health, and then in 1912 renamed Public Health Service. In 1910, tuberculosis in the garment industry was one of the triggers leading to the entity of the Public Health Service for workplace health and safety. In 1916, we established Johns Hopkins University, and that's a big leader in looking at cures for disease and incidence. 1921, the Bureau of Indian Affairs was created. 1935, Food and Drug. That made a big impact on public health. And then in 1944, penicillin changed the way we treated infections. Prior to 1944, there really wasn't any antibiotics around. A little bit of sulfa, but it didn't do a lot. But penicillin. And the first penicillins, what's interesting, is that they couldn't produce enough of it, and they tried it out, and it worked, but they ran out. And then the person that they were trying it on eventually did die, but they actually tried to get penicillin out of their urine just to create more. But 1944 and the birth of penicillin was a milestone in public health. 1946, they established the Communicable Disease Center, which eventually became the CDC. Their first focus was mosquito control to fight malaria. And notice the pesticide DDT that you used, which is now banned because DDT, for those that are old enough to remember, weakened the shell of eggs of eagles and almost helped eliminate the eagle population. So DDT, although it worked for mosquitoes, is now a banned substance. From that beginning, CDC grew to its current emphasis of working with states to monitor and prevent outbreaks, maintain health stats, and prevent and control infectious and hazardous diseases. Then in the 1950s, we had the creation of the Department of Health, Education, and Welfare in the United States government, and then that was split off in 1979, where we got the Department of Health and Human Services. In 1955, the first polio vaccine was licensed, and the Indian Health Service was moved to HHS. Prior to the polio vaccine, entire epidemics of polio would impact populations. And I knew many elderly people who are now deceased, but who were impacted by polio in the 40s and 50s when they were children. And they spent their lives either being disabled or with walkers or in wheelchairs. So very important milestone. 1960s, the other history, the Migrant Health Act passed, requiring reporting for ag workers. Surgeon General's first released information on the impact of smoking. We had Medicare and Medicaid had started, and smallpox eradication program was established. 1967, CDC assumed rights for quarantine functions and provided quarantine procedures. 1970, we created the National Health Service Corps, and then in 1977, the worldwide eradication of smallpox. And that is big news, and it's still eradicated. And then HCBA, which used to be called that, but is now the Centers for Medicare and Medicaid Services, or CMS. 1980s, we had the AIDS epidemic. AIDS was identified. The HIV virus was identified by scientists. And then in 1985, HIV detection through blood testing became licensed, and they were able to detect the HIV virus. 1990s was the Human Genome Project, Food and Drug Labeling, the Ryan White AIDS Resource Emergency Care Act, establishment of Vaccines for Children's Program, free immunizations. Let me tell you, this was big because my children were born in the 80s and there was no free immunizations, and it was very expensive to get your child vaccinated. They had HIPAA. They established SHIP, State Children's Health Insurance Program. Then in 2000 and 2009, it progressed, and then we had ARA and the high-tech stimulus opportunity. These are terms related to public health. You're going to learn these in health statistics as a second-year students, but the two terms are incidence, prevalence of disease. Prevalence is that portion of population with a specific disease, and incidence is the number of new cases of disease. So these are all terms related to public health. Here's a little chart of our public health expenditures. If you look at that, it's not as much as other expenditures, but it's part of that. It's the public perception public health is restricted to visible aspects such as communicable disease and now in recent years bioterrorism surveillance. However, it's a very small portion of the public health arena. Under the United States, Medicare and Medicaid can still consume the majority of the budget. Here's our core areas of public health and what they'd like to do. Behavioral health, biostats, EMS, environmental, epidemiology, nutrition, and so forth. How it's organized, you have local health departments, state health departments, and the Centers for Disease Control in all agencies. Most states are associated with the network of local or county health departments. For example, NICC, we're in Northeast Iowa, every county in the state has a local public health department that will send out information and collect information on the incidence of disease. That information goes to the state health department, and then it goes to the CDC. There is also state laws that say what must be reported and when, and some things are specific to a state. Public health roles are here. Their roles include education, policy setting, services, regulation, lab services, and monitoring. Disease reporting regulations, you can read over. I just mentioned that a few slides ago, so be sure to read that in your transcript. Examples of nationally notifiable diseases in 2010, and these are still the nationally notifiable diseases that has not changed. Anthrax, diphtheria, Giardias, hepatitis, Lyme, malaria, and measles. And then non-infectious conditions such as cancer, blood lead levels, pesticide. Here's the flow of data. You get your sources from your lab's clinicians. They go to your local health department, who goes to the state health department, to the CDC. Some conditions are so severe they go right to public health. Notice here that it says everything is de-identified. So if you've got, let's say you went in and you were treated for measles, which is reportable. When that information finally gets to the CDC, it's not your name going in, but what does go in, it says measles in a blank-year-old female person in the state of Iowa. And they'll give the location, but you're de-identified. Your name will not go there. Public health progress in the 20th century, it did improve population health. The big improvements were life expectancy in the 20th century increased, infant and child mortality decreased, and the incidence of communicable diseases or contagious diseases decreased. Other progress that happened, it's impossible, they say, to spend a single day in the U.S. without being affected by public health. So these are things public health monitors. Food safety. They do restaurant inspections. They monitor fluoridation of water. Seatbelt use education. Use of unleaded gasoline. Flu vaccine programs. Nutritional information. And public health responses to disasters. There are some Mars, or not everything is rosy with public health. There have been incidents where they really abused their power in their research. One of the famous ones was the Tuskegee study in 1932, where the effects of syphilis on African American men. And even though penicillin became available, these men did not get treatment, and many of them did suffer the effects of syphilis when they thought they were being treated. And then another one in the 1940s with that. So there were injustices done, and hopefully in today's world that would not happen again. The greatest health achievements in the 20th century, and this was published at the end of 1999, because they look at the 100-year span to see what were the best things that happened. Number one was the use of vaccinations to prevent disease, significantly smallpox, measles, polio, etc. Motor vehicle safety with the use of seat belts, airbags improved. Safer workplaces with OSHA. Control of infectious diseases. The decrease in coronary heart disease and deaths due to stroke. Safer foods. Healthier moms and babies. Family planning, water fluoridation. And the final recognition that tobacco was a health hazard. Their greatest achievements. Highlights. The life expectancy for Americans since 1900 has increased about 30 years, 25 which can be attributed to public health efforts. Anti-tuberculosis efforts, exams through the Public Health Service, eradication of smallpox, and the decrease in blood lead levels of children. Okay, in 1970s, 88.2% of children studied had elevated blood lead levels. Other things, medical progress has eliminated deaths from previously rampant diseases such as measles, diphtheria, scarlet fever, and whooping cough. And I knew growing up, we had children at my age who got scarlet fever who suffered long-lasting damages from that disease. So the battle against disease has been so successful that in 2007, the top 10 causes of death, only 2 factors, 8 and 10 were not chronic or disease injury related. So these were the top 10 causes of death in the U.S. And I updated this, but this is in 2017. Our top leading causes of death: heart disease, cancer, accidents, whatever. Number 10, suicide, just made the top 10 in the last 10 years. Okay, and we'll go to part 2.